Okay, I'm in the bedroom right now. Gonna do some hand hygiene. My patient COPD is due for a dressing change of her central line catheter, which I saw in her charts. And I also saw that she has an order for normal saline 10 milliliters and heparin 5 milliliters. So let me go get those. While I'm in the bedroom, I'm gonna do my first check on both of these. That all matches on the chart, and I also see on here that the measurement of her lumen is about 12.5 centimeters, so I'll measure that when I assess it. Alright, let me gather my supplies. I'm gonna need some sterile gloves and some Tegaderm, some gauze, some sterile drape, some tape, measuring tape, chlorhexidine cleaner, a chlorhexidine biopatch, a positive pressure end cap, I need a pen, some masks, and a green cap, making sure that this bottom is facing the top, or the part that touches the syringe is facing the top.
Yes.
Alright, I think I've got everything. Let me double check. Yes, I think I got it all. So I'm gonna go head over to the patient's room.
Come in.
Hello, how are you today?
Good, how are you?
Good. My name is Ruth. I'm going to be your nurse today. I'm going to provide you some privacy. And wash my hands. Could you tell me your name and date of birth?
COPD 7/10/2001.
Right, that matches. Do you have any allergies?
I do not.
Right. What about to latex, antiseptics, or adhesives?
Nope.
Alright, good. That all matches on the chart. So, see, I am here today to be changing the dressing of your central line catheter. This usually gets done about once a week. Have you had this done here before?
I have, but can you go through it again?
Yeah, so we do this about once a week depending on the facility policy, and it is a sterile procedure, so I'll have to wear a mask and you'll have to wear a mask, and we just have to make sure everything is sterile to prevent infection. Is this a comfortable position for you?
Yep.
Alright. I'm going to set up my triangle. And then I will also be administering to you sodium, normal saline, and heparin sodium. This normal saline is just to make sure that that lumen is patent, that catheter, and then the heparin is to make sure that there are no blood clots that will form on there. Do you have any questions?
I do not.
Alright. I'm going to do my second and third check of these. Beep, beep, beep. That all matches, so we're good to go. Setting up my triangle. I'm gonna put on my mask. And I'll put your mask on as well. And I'm gonna have you turn your head away from where your central line catheter is, just to make sure that you're not breathing. Just to make sure you're not breathing on it, and just to really make sure that it doesn't get infected. We're doing as much as we can.
Sounds
Keeping you
good.
safe.
Okie doke.
Alright. Okay. But before we start, I'm going to set up my sterile field. Get things out of the way. Difficult bag to get open. Making sure I only touch the outer portion. Okay. A lot of stuff to set up. Alright. I'm just Just gonna make sure this is in a good spot. This is still not touched anything. All right, I'm gonna go get some clean gloves. Okay, see, I'm going to assess your sight here. Is it okay if I pull your gown down a little?
Yeah.
All right. So I see everything is clamped, making sure I don't turn my back to this. Everything is clamped. We've got tapes on here. I don't see any signs of infection, no signs for infiltration or any other complications. It is not warm to touch. There's no redness. Do you feel any pain? See?
I do not.
When I touch on it? No? Okay. Good. So that looks good. I'm going to take off your dressing now. So I'll start with a tape. And I'm going to hold on to this and start with the outer corners, rolling it in as I go. So I get a good grip of it. I also notice here that there are no sutures. Everything that is supposed to be intact is intact. And get the corner here. It's hiding under the pillow. Alright. That bio patch. Oop. There we go. Okay. Now I'm going to start with the sterile procedure. Just clean the hands. Open my gloves up. I'm going to move this over just a little just to make sure I don't bump onto it. Sterile gloves are always a challenge, especially when you have sanitizer. I have already put them in so I can fix them. Got fresh sanitizer on my fingers. It's a little difficult. Okay, now I'm going to grab the gauze and this, and I would click on this to activate the liquid. I'm going to use this to pick up the lumen, and then I'm going to be scrubbing for 30 seconds. I'm going to be doing left to right, up and down, zigzags, and I'm going to include about 1 inch of the lumen. And also the sutures if there were some, but they're not in this place. Circular motions here, making sure to get under. Really get it good, scrubbing. Alright, that should be good. Throw that. Then next, going to get the chlorhexidine. And if this had a blue side, it would be facing up to the sky. I'm gonna open it up, hold on to this. Alright, there's that there. Now, I'm just going to put this away. I'm going to get, this is my sterile hand, so I'm going to get the sterile Tagaderm. Inoculate this. I'm going to make sure that this is centered. This is my clean hand, so it's okay if I can straighten these out. Making sure this is centered. Some of these Tagaderms are a little difficult to undo. But there we go. That is in place there. Making sure I get the edges. Alright, now these gloves are clean now. They are not sterile anymore. I'm going to measure the length of the lumen from the insertion point to about the tip here. So making sure it matches up with the chart. Yes, and that is about 12.5 centimeters, so that looks good. All right. Now I'm going to secure this with tape, just to make sure these don't move around a lot. And then I'm going to label the dressing with my initials, today's date, and then the time, which is, it is 17:35. That on there. All right, how do you feel, C?
I feel good.
Good. So the next thing is to do the flushes. I'm going to just first I am going to take the lid off of this and making sure that I don't touch the bottom because that is going to attach to here. Prime the saline. There we go. Then I'm going to take this off. Oh, whoever put this on last did a really tight job. I'm going to put this down for a second. They put it on really, really tight. Okay, there we go. Took a while. Whoever put that on made it really, really tight. Okay. Now I'm gonna make sure that that doesn't touch anywhere. Take this off. That in. Okay, now I'm gonna unclamp. Gonna aspirate for some blood return. I see some. If I didn't see some, I would ask the patient to lift their hand or reposition, move their arm around. Now I'm going to administer this saline over 1 minute. Do you feel any pain or discomfort?
Nope.
All right. Now it's been a minute. Can toss that. And I'm going to do the heparin. Making sure I don't touch the tip of this. And then I'm going to prime it. And then that can just go in, not at a specific rate, as long as it goes in smoothly. All right. And then now I'm gonna put the sterile cap on. Clamp this. Everything still looks good and intact, so that should be all good. How do you feel, C?
I feel good.
Good. And get rid of my supplies. I'm going to go over the bed. I'm gonna take your mask off though. You don't need that anymore. I don't need mine anymore either. All right. I'm gonna wash my hands. Here's your call light. And let me document how that went, which it went well. All right, let me know if you need anything.
Okay.